If you're not feeling well, how do you decide if you should go to urgent care or if you need to go directly to the ER?
It was in a strip mall next to a nail shop and a phone repair place.
Just much easier than going to my primary care doctor.
We are a lot more convenient.
It's no secret that on a fundamental level, the public-private system of healthcare that we utilize predominantly here in Europe is just different from that of the United States. From the way it is financed and funded to the vastly different utilization rates and healthcare outcomes for its citizens. For Americans who come to Europe and experience it for the first time, it's obviously one of the big culture shocks. But there's one very specific facet of the American healthcare system that, truth be told, when I first moved to Germany, I kind of missed about the United States. And that's the fact that I could never seem to find an urgent care center here. These McDonald's of the American healthcare system are convenient, independent, and act as walk-in clinics that generally focus on the delivery of medical care for minor illnesses and injuries in an ambulatory medical facility outside of a traditional hospital-based or freestanding emergency department. And to be honest, I use them a lot in the States for after hours or weekend care, from everything from an ear infection to a sprained ankle. But for instance, here in Germany, they really don't exist. And to be honest, I genuinely missed them when I first moved here. It was an option that I kind of wished would have been part of the healthcare system that I experienced here. And it's one that I haven't actually talked about before on this channel, so I think it's time that we finally take a look at them.
Access doesn't mean a damn thing.
American healthcare has undergone some pretty systematic and fundamental changes within the last few years. But because the debate of private versus universal healthcare is such a highly partisan and lobbied topic, you might not know what is actually going on if you only read a few news sources or rely on social media algorithms to tell you what's going on. That's why I always use our sponsor, Ground News. They are an app and website that compiles local and international sources all into one place. This gives me an easy, data-driven, objective way to read the news. For example, this recent story on North Carolina's expansion of Medicaid coverage was covered by over 35 news outlets with a majority from center-leaning sources. As you can see, there are only 13% of right-leaning sources, so if you only read from right publications, you may have missed this story. It also shows that 90% are high factuality, so there won't be as many sensationalized headlines in the mix. The Herald, tagged as left-leaning, highlights how to check eligibility and how to get coverage. But in contrast, the Washington Times, which is tagged as a right-leaning source, states that the expansion was done to quote-unquote slam Trump. Same story, but one side highlights the positive aspects, while the other, not so much. See all sides of every story by heading over to ground.news/Ashton to check it out. You can subscribe through my link for their holiday sale to get 40% off unlimited access to the Vantage subscription, which is what I use. And when you subscribe, you not only support me, you're also supporting a small team trying to make the news more transparent. Although they are wildly popular, urgent care facilities are a generally new-ish phenomenon in the United States. Before urgent care centers, the system in the US was pretty much the same as what you would find here in Germany. You have a primary care and/or family medicine physician for routine checkups or minor injuries. And then there were emergency rooms for, well, emergencies. But then in the 1970s, as the US saw an explosion of quick, convenience-based services and goods, in a way, urgent care centers emerged in tandem, offering healthcare to meet the consumer's demand for affordable, convenient services. And while some decried this new medical model as the McDonald's of healthcare and doc in a box, which is kind of funny actually, the truth of the matter is that especially in the beginning, a lot of these urgent care facilities were actually initially run by emergency services personnel seeking to just provide better coverage within their local communities. But I would argue that the contemporary model of urgent care facilities that we see today really kicked off at the start of the 21st century. The first was an establishment called Quick Med X. now known as Minute Clinic, founded in Minneapolis in 2000. And since their purchase by retail pharmacy giant CVS in 2006, they've exploded. As of 2023, there are now over 1,100 Minute Clinic locations in 33 states and the District of Columbia. But beyond the Minute Clinic, like urgent care clinics of the 1970s, retail clinics and independent urgent care facilities are affordable and convenient, with extended hours, walk-ins, and quick wait times. But their proliferation into US life is really what makes them stand out. Today, they are located in drugstores, grocery stores, in strip malls, and in communities big and small alike across the country. However, it is important to note that the vast majority of these Minute Clinics and walk-in facilities are actually staffed by nurses and physician's assistants, not by med doctors. But in the United States, they are growing in popularity because they fulfill a fundamental role in the healthcare system, albeit one that even medical professionals are skeptical of. On the one hand, urgent care centers are able to strike a really convenient balance between family medicine and emergency care. Primary care physicians often don't have the capacity for quick, short-notice appointments. Plus, they need the rest too and can't always be available for evening and weekend issues. And emergency rooms are habitually overburdened and have to prioritize emergencies over things like fevers, ear infections, minor lacerations, or a broken finger. Data shows that 27% of ER patients could effectively be handled by an urgent care center or retail clinic, which would actually save about $4.4 billion a year. So it's probably unsurprising to the majority of my American audience that retail clinics and walk-in urgent care facilities have really become an integral part of the American healthcare system in its achievement of overall wellness. As of today, there are a record 11,150 urgent care centers in the US with around 7% annual growth. And this figure actually excludes clinics inside retail stores and freestanding emergency departments. And you know, many of you are probably familiar with Murphy's Law, but I'd like to present you with Ashton's Law, which is that whatever can go wrong will go wrong, usually within closing hour on a Friday evening. I can't tell you the number of times that I seem to pick up an ear infection, a sinus infection, or a fever on Friday when my house arzt or my primary care physician here in Germany is closed for the weekend and I can't make an appointment until Monday. And I know that many of you are probably going to say in the comment section that I could have gone to the hospital or tried to seek out emergency care. And maybe this is just PTSD as an American, but it's still pretty ingrained in me that emergency departments are truly for emergencies and that you don't go there unless you're on the brink of death. I know now it's not so much a cost issue, but that's still very much sort of the prevailing feeling in the United States. And when I first moved here, I was really reluctant to seek out that kind of after hours care unless I was really, really sick. And so when I first moved to Germany, I honestly missed urgent care facilities in the US, especially because I could literally make an appointment from my couch on my cell phone using an app and then just go in and see a doctor within 30 minutes and not have to sit in a waiting room and wait to see somebody. They are extraordinarily convenient. And yeah, I'd be lying if I said that it wasn't a facet of American life that I initially really missed. But the longer that I've lived here and the more that I've looked really critically at this system, I've also come to recognize that there are some pitfalls to the urgent care process that I think everybody should probably be aware of. I've talked at length in prior videos that American healthcare has an equity problem. Don't get me wrong, there are many very affluent patients who have access to some of the best doctors and the ability to pay for treatment with cutting-edge technology in the United States. But at the same time, there are also a staggering amount of patients who don't. There are hundreds of thousands of people who are young adults, just off their parents' insurance, who are trying to manage with part-time employment or who are working with the gig economy and cannot yet afford to buy health insurance. And there are many more patients who either have no health insurance or who are very underinsured. It's why, time and time again, despite the higher healthcare spending in the US, Our life expectancy and other health metrics are far worse than other locations across the world. The US has the lowest life expectancy at birth, the highest death rates for avoidable or treatable conditions, and the highest maternal and infant mortality rates. In addition, we also have the highest rate of people with multiple chronic conditions and an obesity rate nearly twice the average of the international OECD. And the big reason behind these poor health outcomes isn't that American healthcare is bad. In a lot of cases, it's extraordinarily good. It's just that so many of us can't afford it. Americans see physicians less often than people in most other countries. And so these urgent care facilities also fulfill an economic need beyond just a medical one. For those who are uninsured or underinsured, urgent care is often the only health care they access. Urgent care centers have a reasonable set fee for a single visit, and they're able to dispense many commonly used medications at a set price, which also tends to be reasonable. The caveat to that is that additional services like x-rays, EKGs, nebulizer treatments, medications, orthopedic equipment, and IV fluids cost extra. They can sometimes get around the fee for a blood draw by sending a patient to a commercial lab, but they'll still have to pay for the actual blood tests offered. And at the end of the day, many of these patients are in desperate need of care, as they have serious ongoing health problems and have either avoided care or fallen out of the healthcare system altogether. And many physicians are quite frankly wary of urgent care facilities for this very problem. They often see patients with long-term issues that should be treated by the doctors who already treat them as outpatients and have a well-established communication and plan of care. If they have new or worsening health problems on a weekend or in the evening, urgent care is a helpful addition to ongoing outpatient care, and they can get patients through an acute episode or complication and avoiding an ER visit. But way too often, they are seeing patients for care of chronic problems during regular working hours because their primary care doctors don't have the time to see them, or because they can't get an appointment for months with a specialist they need to see. Approximately 20% of all primary care visits now occur at urgent care clinics, according to UCA data. In 2013, urgent care centers saw 491 million primary care patients, which accounted for 18.2% of all primary care visits in the US and 9.7% of all outpatient physician visits. And please note, this is by no means a condemnation of those primary care physicians or specialist physicians or the patients that see them. It's just simply worth pointing out that we truly do have a primary physician shortage in the United States, and it's causing real problems for health outcomes. When you have millions of people who are simply just managing and scraping by until an illness turns you into poverty, fear of financial ruin prevents many from seeking care, and this can end up in a loss of life. And unfortunately, that's the system that we have in the United States. You know, despite these downsides, patients want quick access to healthcare when they need it, especially when they're ill, and urgent care centers do provide an accessible way to see a doctor with little or no advance notice needed. And to be quite frank, I think that if you were to poll the vast majority of Americans, you would probably find that many of them prioritize seeing a doctor when they're sick immediately than waiting until they can see a physician that they might have an established relationship with. But often, if you peel back the layers of someone's healthcare journey, you'll often still hear stories that people do like to have a connection with their physician and that it does make a difference for their health outcomes in the long term. They might share a meaningful story when a specific doctor took great care of them, or they'll share a story about a doctor who cared for their family for many years. There's still a very primal desire to connect with a person when you're in a vulnerable moment of your health. And I can't help but think that perhaps that's one of the fundamental reasons why urgent care facilities don't really exist here in Germany. You know, at a fundamental level, your care begins and continues through your primary care physician. And while you're probably going to experience wait times to see a physician or a dentist for a routine checkup, which by the way is what you experience in the United States as well, at least from a personal experience, if I have ever truly been sick or my children have ever been sick, I can always get a same day or next day appointment during their Sprechstunde or their, open office hours when I need it. I've never had to wait more than 24 hours to see a doctor if I or anyone I know was really sick. And even the process of seeking out a specialist for more acute needs is directly tied to your primary care physician here. For example, let's say you need to go see an ear, nose, and throat specialist for reoccurring sinus infections. You're typically going to require a new Überweisung, which is a small slip of paper for the insurance companies, for each quarter reconfirming the transition of care from your primary care to the specialist. This, of course, is very practical from an administrative standpoint because it basically tells the insurance companies that this continuation of care has been approved and recommended by my primary care physician. But it also has incredible repercussions for my long-term care and continuation of health as well. My ENT, for example, is located within the University Hospital System in Freiburg, and it's actually pretty cool that every time I see them, they not only follow up with a physical letter in the mail that gives me a copy of all of their findings and results and plan of care, but they also send a copy of that letter to my primary care physician so that he's in the loop of what's going on with my continuation of care, which is pretty cool. And that's ultimately, I think, one of the big pitfalls with the urgent care system that we have in the United States. A 2022 study by Harris Poll, working at the behest of Mercy Health Systems in Pennsylvania, revealed that only 36% of patients followed up with their primary care physician after a recent urgent care visit, despite being told to do so by the urgent care providers in most cases. And at the end of the day, while urgent care facilities are really great at offering people quick fixes, it probably isn't what's best for the long-term health of that person. In a recent JAMA study, researchers found that half of patients who go to urgent care facilities for cold, flu, and other respiratory conditions that cannot be treated with antibiotics are nonetheless still prescribed antibiotics. In fact, urgent care clinics are 3 times more likely to dispense antibiotics than the traditional general practitioner. And again, I'm not trying to shoot these places down because I do think they're doing the best given their circumstances, but they're only looking at a patient through a specific snapshot of what their health is in that moment and not what their long-term care has looked like. And often they don't have the bigger picture of if they've been on antibiotics before, what are their long-term reactions to these things, should we be trying new strategies? Because again, they only see that patient for that brief moment in time and not the whole lifespan of what their health journey has been, which is really important when you're trying to help somebody through a health crisis. But before I let you go, I do think that it is really important that if you happen to have stumbled upon this video because you're interested in learning more about the healthcare system here in Germany, there are a few important resources that I do want to share with you. If you require medical assistance outside of normal operating hours, try calling your doctor anyway, at least in the first instance. They will usually have an answering machine giving the contact details of an on-call doctor. Alternatively, you can also call 116-117 for a non-emergency doctor on call. This number works all over Germany, and the helpline is open around the clock, including evenings, weekends, and public holidays. And you can also visit the website to find a local clinic that offers emergency services. And finally, if you urgently need medication or a prescription, you can find an emergency pharmacy by calling the number here on your screen from a landline or 22833 from a mobile phone. All right, guys, so that wraps up my deep dive today into urgent care centers, the McDonald's of healthcare in the United States. And while, I do think that urgent care centers do provide essential health services in the US, health services, by the way, that I have also partaken in a few times over my lifetime, I can also see how they do expose some of the holes within our current healthcare system. So I would love to hear from you down in the comment section below. What do you think about urgent care facilities? Is this something that you'd like to see more of in your area? Or do you think you'd like to stick with your current system? And at least for in the United States, do you think we should continue to see more and more urgent care centers? And if so, how do we help bridge the divide between short-term care and long-term health outcomes? Please let me know down in the comment section below. And as always, if you enjoyed what you saw today, be sure to hit that thumbs up button. And for more content from Type Ashton, hit that subscribe button. So, I'll see you next Sunday. Tschüss!